my name is Jasmine Johnson, and I'll be doing a central line dressing change. First thing I would do would be to review my medical order, and often the procedure for CVAD flushing and dressing change would be a standing protocol. Next, I'll perform hand hygiene and put on my PPE. I'll gather my equipment, bring it to the bedside. I'll identify my patient. I will provide for privacy, explain the procedure to the patient, ask if they have any allergies. Then I will get my wastebasket and I will adjust the height of the bed to a comfortable position. And I'll also assist the patient into a comfortable position. If the patient has a PICC line, I will extend their arms out below the level of the heart, and I will cover them up with a bath blanket for any other exposed parts that I'm not working on. At this point, I can put a mask on the patient, so I'll open my sterile kit. Take the mask from my patient, put it on them. And then I will take out the mask for myself. I will ask the patient to turn away from the access site, and then I will gather all my open supplies. If the patient has an IV solution flowing through their current port, I will stop the solution and apply a side clamp on each lumen. At this time, I can put on clean gloves. Once I do that, I will assess their insertion site for any redness, inflammation, signs of infection. I'll also check and see if they have any of their sutures left and assess those. At this point, I can remove the old dressing. To do so, I remove the edges inward all the way around. Which will take me just a second. Okay, after I have removed the edges, I will hold the lumen taut as I gently remove the tegaderm from the insertion site. Then I will discard. At this point, I will also discard my gloves and wash my hands. And then I can put on my sterile gloves, which are in my kit. Okay. And I will put on my sterile gloves. Discard my wrapping. At this time, starting at the insertion site, I will get antimicrobial wipe. We'll say this is my microbial wipe, and I will clean the insertion site in a circle. And then I will discard. And then I can take my chlorhexidine swab, and then I'll also cleanse the site. And by doing this, I will do it in a back and forth motion for at least 30 seconds. After my 30 seconds are up, I will let it dry. I won't blot or wipe or anything, and I'll discard. Once the insertion site is dry, I can then apply my protective. And at this point, I'll apply the protective, circular motion to ensure good coverage with the tegaderm. And I can discard. Now, I can stabilize the catheter hub by holding with my non-dominant hand. I will use an alcohol wipe, and I will clean the lumen. So I will clean down, I will clean the sides, I will clean the other side, moving outward. And at this point, my insertion side is clean, and I can apply the tegaderm. To apply the tegaderm, I have my non-dominant hand on the back strip, clean one on the tegaderm, and then I will place the tegaderm over the insertion site. I will seal it, make sure all the corners are sealed, there's no wrinkles. I will remove the extra wrapping. And in the real world, all the wrapping would come off and it would look perfect and clear. And then I'll initial date for the next change and the time. And then my procedure will be done. I will gather my equipment, take off my PPE, lower the bed, put the patient in their good position, whatever is comfortable for them, and I'll perform hand hygiene and document.